Guys, my name's Casey Burtnick, and I chose for the topic of this project to be animal-assisted therapy. So the problem I have found is that the use of animal-assisted therapy in patient care has staff members having little or no knowledge on policy regarding the topic. Rationale for this project is that animal therapy is becoming increasingly utilized, and I feel that is important for the safety of everyone involved if there are adequate guidelines to follow, and that would require a standardized policy. Through the research for this project, it appears that other professionals and hospitals feel the same way, and following is the support for that. When questioned on the use of AAT by nurses, 3 professionals commented that this is an activity that would help them to take better care of patients. However, at the same time, they fear not having adequate knowledge on this technique since there is no proper guidelines to be followed. And that was pulled from one of the articles that I found during the research. The purpose of this project is to explore the utilization of animal-assisted therapy in different hospitals and the adequacy of policies to ensure safety. The research question: has animal-assisted therapy as part of patient care in the United States become successful and utilized of an adequate extent to suggest the need for a standardized policy to be implemented in the hospitals nationwide? So it addresses the population, intervention, comparison, and outcome. Population is hospitalized patients, intervention is animal-assisted therapy. The comparison is the places that use this therapy versus the ones that don't, and the policies they have in place, and the success of the therapy. The outcome is a standardized policy to ensure safety. Literature search. These are the titles of the 5 articles that I found. I guess I'll read through them. Can therapy dogs improve pain and satisfaction after total joint arthroplasty? A randomized control trial. The next one is animal-assisted activities. Results from a survey of top-ranked pediatric oncology hospitals. Next, assisted therapy with dogs in pediatric oncology. Relatives and nurses' perceptions. Next is animal-assisted interventions. A national survey of health and safety policies in hospitals, elder care facilities, and therapy animal organizations. Lastly is measuring the effects of animal-assisted intervention for pediatric oncology patients and their parents, a multi-site randomized control trial. Kind of a side note, if you'll notice, each article has a different take on the term that they use for the therapy. Some use animal-assisted activities, animal-assisted interventions, just animal therapy, but it's all based around using animals for the use of therapy in patients. So to search the literature, the strategy that I used was using CINAHL Complete. I went to the advanced search section, which in that I selected for it to be peer-reviewed, to be a research article, to provide full text, and there's a date range that you can use to ensure that the articles are within the past 5 years, or you can extend it if you wanted to look in the past 10 years. The first search that I used, the key terms were animal-assisted therapy and hospitals. This generated 17 different results, along with that advanced search and those keywords. I narrowed this down by choosing mostly US-based studies. Only one was outside of the US. All of the studies directly involved patient care. There's a discussion of policies, supported the use of animals supports the use of animals as therapy. And I avoided meta-analysis and systematic reviews and focused on primary research articles. The next time I searched to find the last article that I needed, the previous search, I actually found 4 out of the 5 articles. So the keywords that I searched were therapy dogs and hospitals, and used the same technique listed above to narrow down the search. Reflection on the search, I kind of mentioned it before. CINAHL is the preferred database to search because of using that advanced search. I kind of noticed that it was exhausting skimming through articles to narrow down choices and look for keywords that I needed in order to create this project. my original path of research changed based on what articles that I found, which just goes to show that it does identify potential areas of studies. And there were a lot of different ways that I could have gone with this. It was also difficult to find primary research articles. There were a lot of meta-analysis and systematic reviews. Each article was compared and contrasted using 4 main categories of information. These were the design of the study, the purpose of the study, tools used to conduct the study, how the sample was selected, and then results and conclusions drawn from the research. So 4 out of my 5 articles were quantitative, and only 1 was qualitative. I wanted to have at least 1 different because I think it provides just a little bit well-rounded background information for the research, a different approach, which can provide more accurate information. So each one had a different purpose that was listed towards the introduction of the study. The first one is the purpose of this study was to evaluate the role of animal-assisted therapy using therapy dogs during the immediate postoperative period after THA and TKA. The next one. Therefore, the aim of the study was to investigate the AAI program policies in hospitals and elder care facilities across the United States, as well as policies and procedures of regional and local therapy animal organizations. Next one is, the goal of the study was to describe AAA practices and policies in leading pediatric oncology hospitals. Understanding current practice of AAA in pediatric oncology is necessary for formulating a research agenda to evaluate the safety and effectiveness of this increasingly common service. The next one is, thus, our objective is to understand the perception of nursing staff professionals and legal guardians of children and adolescents with cancer regarding assisted therapy with dogs in a reference hospital in northeast region of Brazil. Lastly is, according to McCullough, the purpose of the study is to support the following hypothesis. When compared to those who do not receive animal-assisted intervention, patients with childhood cancer receiving AAI will have less anxiety and stress, along with improved health-related quality of life. The parents of these patients who receive AAI will have less anxiety and stress. So this really helped me choose these 5 articles because the purpose of the research study was all related in some way. The sample of the study and selection used in the studies. So Linder used a randomization to select samples from hospital and elder care facilities along with different AAI organizations. Harper used randomization to select patients who were attending physical therapy after their TKA or THA. Chewbacca and Hawks used purposeful selection to select different hospitals that were using animal-assisted therapy. Lima used purposeful selection to select samples from legal guardians of patients receiving animal therapy and nursing staff involved. McCullough used randomization to select samples from pediatric oncology patients. So there's different approaches to selecting the samples. Some were randomized, some were purposeful. So that really helps in getting kind of a mix of information to take in. Tools used to collect the data. Harper used a VAS pain scale and HCAHPS survey, which is like a hospital satisfaction survey that were filled out by patients. The pain scale was used each time before physical therapy, and then the HCAHPS survey was at the end of the hospitalization before discharge. Linder used a combination of online, telephone, and email surveys to collect information. Chewbacca and Hawks used a survey to collect data among different hospitals. McCullough used a state trait anxiety inventory questionnaire, pediatric quality of life inventory questionnaire, pediatric inventory for parents questionnaire, and then a combination of both manual and automatic ways to measure the blood pressure and heart rate of the patients. Lima used observations and interviews to collect the data. The different results that came from these types of research. Linder found that there were significant discrepancies of policies for animal therapies among different hospitals and a lack of standard requirements from the organizations that provided the therapy. Harper found that the use of therapy animals before PT for patients of TKA or THA lowered the pain levels and improved the HCAHPS scores at the time of discharge. So lowered pain and improved satisfaction, which is fantastic. Lima found that both guardians and nursing staff of pediatric patients receiving AAI found that this use of therapy is a benefit to patients. McCullough found that there was less stress among parents of the patients receiving AAI, and there's also a stable trend in blood pressure among patients receiving the therapy compared to those who did not. The patients who did not receive the therapy, their blood pressure went up over time. Chubak and Hawks found many variations among hospital policies regarding animal-assisted therapy. Conclusions from all of these results and comparing and contrasting is that it's pretty clear that animal-assisted therapy is a successful approach of therapy for patients in hospitals for a different variety of reasons. The use of this animal-assisted therapy is growing and sought-after approach in improving patient care and satisfaction. And it's also definitely clear that there is a lack of consistency with policies that are being used in hospitals regarding the use of animal-assisted therapy. And this was addressed in all the articles. A recommendation that I have is, based on the findings through research, it is recommended that hospitals nationwide work together to create a standard policy for animal-assisted therapy in order to ensure safety and help increase the use of this successful form of therapy. Support for this is that in the research article by McCullough, they note that to successfully incorporate this type of therapy into practice, there needs to be comprehensive safety and health protocols. And then Lima, they reported in the discussion of their article that nurses reported having a sense of fear because they did not have adequate knowledge and there were no proper guidelines regarding animal-assisted therapy. As far as how these support that recommendation, the first one is laid out pretty clear. It just says that in order for this to be successful, there needs to be these protocols, policies, guidelines. The next one, if nurses have fear of this animal-assisted therapy, it means that they're fearing the safety, and also if there's no proper guidelines, this therapy is not going to be successful. And it's important because this really does help the patients. It's proven through these research studies that it does help. Takeaways from this, encourage the use of animal-assisted therapy because it really works. Know your hospital's policy on animal-assisted therapy. Do some research and advocate for a standardized policy. Just talk to coworkers about it if you're on any like evidence-based practice committees, or there's a variety of different committees that this topic could be useful to talk about. And take it up the chain of command and just advocate for the use. These are the 5 research articles, and that is it. Thank you.